Welcome to the meeting of the Public Health and Safety Committee for December 3rd, 2025. I am Jason Chavez, the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. The broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments to the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I'll ask the clerk to call the roll so we can verify quorum.
Councilmember Payne.
Present.
Rainville.
Present.
Chowdhury.
Present.
Palmisano. Apologies, I don't think the microphones were on for that. Let's start over. Councilmember Payne.
Present.
Rainville.
Present.
Chowdhury.
Present.
Palmisano is absent. Vice Chair Wansley
Present.
and Chair Chavez.
Present.
We have 5 present.
At this time, I will let the record reflect that we have a quorum. I'll remind my colleagues that we'll be using speaker management today, so please make sure that you're signed up. If you're here for one of the public hearings and would like to speak, please be sure to do so with the clerks. We'll start with the consent items, and I'll actually make an amendment to the agenda without objection. I will like to move item number 10, the Office of Community Safety Quarterly Report, to be on the consent agenda, so we can just receive and file it and take action without objection. All right, colleagues, the consent agenda has 2 items. Item number 1 is authorizing a funding agreement with the City of Lakes Community Land Trust for real estate purchase. Item number 2 is receiving filing a quarterly report updated related to eliminating childhood lead poisoning. And item number 3 now would be the Office of Community Safety quarterly updates. And I will move, and that will be a receive and file. So I'll move those motions for approval. I'll ask to see if there's anybody on queue for those items, and would like to reflect that we are joined by Councilmember Palmisano. That being said, on the motion to approve the consent agenda, which also now includes the receiving and filing of the OCS, all those in favor say aye.
Aye.
Those opposed say nay. Any objections? All right, thanks, colleagues. Our next item is a public hearing on the off-duty use of city resources. This is amending the ordinance related to fire and police protection to add reporting requirements for the use of city resources in outside work. I will pass it to my colleague, Vice Chair Wansley.
Thank you, Chair Chavez. I would like to just take a few moments to speak briefly to this ordinance titled Off-Duty Use of City Resources Reporting that I'm bringing forward for council consideration. This ordinance is another piece of ongoing work that you all are aware of. My office has been working to advance for almost 4 years now. And this is just another piece of that work of making sure we're improving and increasing transparency around the city's off-duty work and programs. The goal of this ordinance is to improve and create accountability measures within MPD as it relates to off-duty and the city resources being utilized to implement it. This ordinance will require the administration to provide the council and the public with quarterly updates on the usage of city resources related to off-duty work. This information would include the site addresses, the off-duty work is being performed at, how many hours were work utilizing city resources, and any unpaid fees attached or associated with that work. Again, since entering City Hall now, back in 2022, I've sat on the Public Health and Safety Committee, and throughout those years, all committee members, as well as council members at large, have had many conversations related to off-duty work. And in the 4 years since those conversations have started, I wanted to highlight that any substantial change that has happened to the system was largely in response to council's continued persistent oversight over this system and not due to MPD or the mayor leading with a vision of reform for this program. I also want to mention that the deputy director of the Office of Community Safety Center did send a memo over to council members or committee members. I believe that memo has been uploaded to LIMS. And I do want to be clear on it. I was actually incredibly disappointed in reading it, as it did seem to have a very revisionist understanding of how the work that council has moved forward around off-duty, how that work has unfolded over the past several years. In the memo, I also heard the same recycle excuses as to why MPD has not prioritized the regulation of off-duty work, and with full awareness of what measures needed to be put in place to do that. I have heard city leaders consistently pointing to the same specific things as opposed to actually making those changes. And specifically, I've heard around concerns related to time tracking data management issues be referenced as a barrier for implementation of regulation over off-duty. But to be simple, there is literally no excuse for a department that has a multi-million-dollar budget to continuously ignore the very clear and identified changes that have been put in front of the department's faces time and time again around how they can go about regulating this system. These problems have been identified. Solutions have even been brought forward on how to address this by various agencies. These include our own internal agencies, such as the Audit Committee, who has done numerous audits over the system of off-duty and have provided recommendations to MPD and the mayor time and time again of how they can make changes. Those recommendations have come from agencies like the Department of Justice, which said that our current MPD off-duty system was ripe for corruption and was a barrier to accountability in policing. So I want to be clear that it's not a lack of options or funding as to why MPD has not enacted change regarding off-duty. There's simply a barrier of a lack of political will. I also know this because in many conversations around advancing regulation of this work, we have become aware that there are several companies and vendors who are willing and ready to do this work right now, of doing the timekeeping, of providing the database management services that MPD has said that they needed. MPD is also aware of this. Their staff is knowledgeable and have done research on this about the vendors that are willing and ready to do this work if a RFP was administered today for it. They could have, and by they, MPD, could have moved forward with the implementation and a contract for those type of vendors on their own for years, but have choose not to. Also in this year alone, council has passed numerous actions related to regulating off-duty, which MPD and OCS has been well aware of and have been part of those conversations, and could have had the opportunity to put those implementations, purchase the timekeeping sites or wherever that they needed. They could have done that this year, also chose not to. But there will be more discussions around this, starting with markup that's happening on Friday. But I want to at least highlight that for years, taxpayers have been unnecessarily subsidizing MPD side gigs, and we're talking about a subsidization in the millions. And council has taken its authority serious to offload that financial strain off of taxpayers and to actually place it where it rightfully should be, and that's amongst those who are soliciting those services, and for us to have a transparent and very documented process of how we're tracking those fees, specifically for the city resources that MPD officers uses when they're carrying out their side gigs through off-duty. So I, again, just want to encourage my colleagues to support this ordinance. If we continue to let this work just sit by the wayside, which it feels like MPD often wants, then we would not have had any action taken. And council has been the leader in making sure action is being taken, so we don't have off-duty program that's continuously being unregulated, that's putting civilians and officers at risk of harm and putting the city at tremendous amount of liability or being liable for financial risk. And I'm really grateful that my colleagues have used their authority to prioritize police reform in this aspect. And I hope the administration will continue to meet us where we're at around treating this work with the seriousness that it deserves. And even when they don't, I know this body will continue to make police reform a priority, and we're doing that with the consideration of this action today. So with that, I will stand for any questions and also move the ordinance forward for approval and also ask for a second.
Second.
All right, colleagues, before we jump into good discussion and ask questions of the author, I would recommend that we open the public hearing and then begin discussion. Great, thanks for getting off cue. Our item is, I will now proceed to before I begin to open the public hearing, I'll ask if you're here to speak on this ordinance to please sign up with our clerks right up here and sign in. I will now proceed to open the public hearing and ask if anybody has signed up to speak on the ordinance.
Mr. Chair, there are no members of the public signed up to speak at this time.
Thank you, clerk. I will ask one more time if you're here to speak on the ordinance to please sign up. Otherwise, I will close the public hearing, given that no one wishes to speak. Now, colleagues, if you wish to speak on this ordinance, please get on queue. I'll pass it first to Council President Payne.
Thank you, Chair Chavez. I just wanted to get in queue to thank Vice Chair Wansley for her just tenacity on this topic and her leadership on this topic. And I think the most generous thing to say about this is that we have a tremendous amount of reform work to do in MPD. Like, that's not new news. That's not a shocking revelation today. And so much of the work of this reform is about prioritization. And I think that our job as policymakers is to bring a democratic lens to what our priorities ought to be when it comes to this very long roadmap of reforms that do need to be implemented. They're not going to be done in a day. They're not going to be done in a week. We hope they'll be done faster than a decade, right? And this body of work maybe is received by people as contentious, but really what this is saying there's a lot to do and we need to have really focused priorities. I think off-duty is one of those areas that we need to have some of the highest level of priority when it comes to reform work. And so I'm just really grateful to Vice Chair Wansley's leadership on this, to keep this at the top of our mind, at the top of our agenda. And, you know, there's been a lot of actual legislative work behind this. This is one of many ordinances to get us to an actual comprehensive, well-regulated off-duty program that is navigating some very sophisticated and challenging legal constraints, especially around court injunctions and so forth, that outside of the consent decree. So this has taken a lot of work, a lot of exploration, a lot of curiosity, and it's just a reflection of what I think we do when we're doing our best work. So thank you.
Next up, we have Councilmember Palmisano.
Mr. Chair, I can't see around the post. Is Mr. Jeffries here in the audience? I would like to ask if he is willing to come up and help explain the limitations that you outlined in your letter yesterday. Councilmember Wansley, as you heard, indicates this is a lack of political will. Is this about technology or staff or some other factor limited?
Chair Chavez, Councilmember Palmisano, I am Jared Jeffries. I'm the Deputy Commissioner of Community Safety for the City of Minneapolis. To your question, Councilmember Palmisano, I'll just say up front, the administration is very supportive of the fee collection, of moving this work forward. So I don't want that to get lost, that we are very much aligned with the intention of the proposed ordinance amendments. I think what we tried to reflect in the memo that we submitted was we're just asking for additional time before this becomes effective to allow the IAT solutions and some of the other decisions that we as a city need to make, especially around how are we actually going to collect the fee, to actually be figured out and implemented. We've got timelines for some of these technology solutions, so specifically replacing our timekeeping system. As a city, that is an entire city project that is underway that's currently being applied to the police department, fire department, is taking place in other departments already. So it's moving right now. What we would like to do on the technology solutions is have that in place and then layer on top the platforms that Councilmember Wansley actually referenced, and so that those are able to work together rather than trying to get an external platform for tracking off-duty first, not knowing how well it's going to line up with the new timekeeping system. And overall, several council members mentioned the tie-ins with the consent decree specifically. We have to be monitoring how many hours overall officers are working. We have to be monitoring so many different parts of the off-duty portions of the work that MPD officers are doing. And so we're just asking for a little bit of additional time to be able to sequence that in a way that we think would be most efficient and most effective.
Thank you. And I mean, I understand that it's complex and it hooks in with a lot of on-duty stuff and time counting and that. As you can see, we're all antsy up here about this, myself included. And I support this ordinance, but at the same time, I want to make sure that we implement it correctly. Regardless of political will or something else, we need to be prepared. I think there's a budget amendment coming about this. It sounds like this is more about timelines. So if a budget amendment is approved, what, from your perspective and all the moving parts that you say, would be a reasonable timeline?
Chair Chavez, Councilmember Palmisano, I believe in the memo we indicated for the IT systems to be in place, we think Q1, Q2 of 2027 is reasonable. And we're giving ourselves some additional time for the new timekeeping system to be in place, and then give ourselves time next year to actually be able to add those additional IT solutions on top of that timekeeping. So we do think Q1, Q2 of 2027. And as far as how the staffing plays into this as well, we can add more staff, but the technology solutions are still going to be needed so that we're not manually having to pull this information and audit ourselves in the way that we're currently doing, which Chief O'Hara and the MPD leadership have enacted several policy and structural changes within the department to, again, do exactly what you all are talking about, which is hit at this work more quickly, but having to do those things in sequence, the things we can do right now versus the things we know we have to do later.
Thank you.
Next up is Vice Chair Wansley.
Thank you, Chair Chavez. Just want to offer a few clarification points because, as I mentioned, we've been having several meetings about this, as Council President Payne, who's also been a co-author on this work, has noted. And I don't think Deputy Director Jared Jeffries has been part of those conversations for a year in terms of the many discussions we've had with staff where since 2022, timekeeping has been referenced as a barrier or something that MPD has been working on. It makes no sense as almost 4 years later with funding at your discretion for you to still reference that as a barrier when this was also listed in 2022 from those conversations. So that's what I noted. We're hearing the same rationales from 4 years ago be referenced as a reason as to why implementation can't proceed. And implementation for 2026, that should not put anyone by surprise. We passed a fee schedule this year that noted we wanted fees to be collected starting in 2026. The legislative directive where we pull literally the research and the information for how to implement this and do regulation came from OCS and MPD itself, from giving us how to do this work. And it all was with the goal of 2026. So implementation could have always been put in place for earlier, enactment of a vendor to do timekeeping. Those things could have happened. And those are operational decisions where I do think that was a matter of prioritization and thus will. Because if there was a will, and we've touched base with OCS and MPD multiple times, this could have happened back in the spring. This could have happened when we passed the first ordinance in January of last year. So I want to provide that clarification. Also, just to ground what this ordinance is actually asking for, it's for reporting. It is ridiculous to think that MPD, with its discretion of a $200 million plus budget and tons of staff, that you're even in your memo, you're saying most of this is being tracked manually. There is some tracking. So that tracking that you're doing, be it manually as you're on-ramping to finally put digital systems in place, that could all be used to do the reporting part that we're asking. And the reporting, I'll read the language that's very clear in the ordinance, which I also want to give a thank you to City Attorney Amy Schutz, who helped us co-craft this. It literally asks that the police department submit to the city council and the mayor a publication on the city's website that's also in accessible format, to publish a report of the following in respect to the use of city facilities or equipment and the performance of outside work during the prior reporting period. And that's to include the site address of each outside work location, using city facilities and equipment for the performance of outside work, the number of hours for which city facilities or equipment were provided for the performance of outside work at each outside work location, and also the total fees charged for each outside work location and the amount of any unpaid fees. This is information that should already be tracked in retrospect. This is what it's asking for. It actually doesn't even go into timekeeping and all that. These are matters that's being flagged by the administration. We are absolutely just asking, if you are collecting fees, you should be able to report how is that happening? Where is off-duty happening in the city? And if right now MPD is keeping tabs by paper or whatever, Excel doc or something like that, then bring that forward. And that is what this ordinance is asking for. Simple transparency and reporting, and for that to be made accessible through the city's website. So I also want to ground what is being asked of in this ordinance of MPD as it pertains to off-duty. So just want to ground that, and again, would ask for my colleagues' support.
Council President Payne.
Thank you, Chair Chavez. Just bringing it back to the kind of comprehensive reforms that we're working on here. Just philosophically, a settlement agreement is a floor, not a ceiling, right? So for all, like, having the entire consent decree implemented would be like the bottom level of what a strong reform program looks like. Nothing is preventing us from going above and beyond that other than political will, right? And I think, I had to research this really quickly on the day, as I couldn't remember the exact number of years. I've actually been understating this. Oakland has been out of compliance with their consent decree for over 20 years. I used to think it was around 20 years. It's been over 20 years. And it is important to put a mile marker down on what our timeline expectations are. And it's also important for us to be aggressive about those timeline expectations, because if you're not aggressive about it, you're going to find yourself 20 years from now going, oh, gee, I guess we still have a little bit more work to do. So I'm very comfortable moving forward with this ordinance as it is. I think we need to be very mindful about what it's going to take, and what it's going to take is a sense of urgency, because if you don't have a sense of urgency, you're going to find yourself with a decade goes by, 2 decades go by. At this rate, Oakland's going to be approaching 3 decades of just not actually hitting the floor, right? The floor of expectations, not the ceiling. And so I think, to Councilmember Wansley's point, even if we don't have a fully built out, tested time management system until Q1, Q2 of 2027, that doesn't mean that there's nothing at all whatsoever to report publicly about off-duty work. Like, I know that the Home Depot at the Quarry in Ward 1 typically has an off-duty officer. I shouldn't have to go running around the community looking for parked squad cars to have a sense of where off-duty shifts happen in our city. That should be something that should be publicly available. Even if you don't have the rigorous software implementation for the time tracking to be able to be fully compliant with the requirements of this ordinance, that doesn't mean that goal of transparency for our community shouldn't be there with a timeline. So I'm very happy to support this ordinance.
Councilmember Chowdhury.
Thank you, Chair Chavez. Really grateful to see this coming before us here, and grateful to be a co-author on this as well. I think with off-duty and many things in the city of Minneapolis, good governance comes from good data, and that's been missing so long with off-duty, this very opaque, hard to understand secondary employment system that we had and how it uses city resources. So I think it's great that it's coming today, but it should have been done, this should have been done in 2017, 2018, a really, really long time ago. I think this is many mayors have tried to tackle the issue of off-duty, probably dating back to Sharon Sells Belton, if not further. So I really, really struggle with this request to delay this to Q1, Q2 of 2027, and also without a clear picture of what steps would be taken in order for this rigorous timekeeping software to come together, because oftentimes we say from the administration side Q1, Q2 for something in a specific year, and then there's a request to push it back, and that's what I worry about. As an author of the encampment reporting ordinance, I have seen, especially in getting the latest report back in our last business housing zoning meeting, how valuable it is to get that information. It really articulates to the public not only how much money and time is being used, but how things change over time. And it informs actions that we take as a body, and we can answer questions better to our community. And that reporting that we require out of regulatory services, a much smaller department, is much more intensive. And there are so many fields that are required, from number of affected individuals, the type of location an encampment is, the date of closure, if there was an encampment within a mile of the encampment that was closed, if supplies were discarded, if service providers were contacted, and also requires communication with Hennepin County. Very, very intensive. And regulatory services has been able to pull together a quarterly report for us after that ordinance has passed. And I think it's really important if the Minneapolis Police Department, if Office of Community Safety needs to create an external way to track, that is what I think they should do. It's not the perfect outcome, but I don't think perfect should get in the way of progress and also good data and good governance. So I'm excited to see this move forward, and also give grace to the fact that the initial report may not be the perfect report that the police department and OCS wants to give, but I have seen with regulatory services, they have been able to, time and time again, improve their reporting to this body, and it has gotten better, and there have been many learning lessons from each report and how they can do it better, and also give us information on how we can support them in good reporting.
Thank you, and I put myself on cue. I just want to thank Vice Chair Wansley, Councilmember Chowdhury, Council Vice President Chugtag for bringing this ordinance forward. And I think it's really important because we are trying to do everything that we can under our authority when it comes to oversight, and also finding ways to use what this legislative branch, the tools we have to address police accountability and reform, which is very minimal at times, but this is one of the ways that we can actually use what is under our charter authority to do oversight. And we know from the encampment reporting ordinance that behavior does change, because staff then get to analyze through these reporting, through transparency to the public and to the council, things that need to change for the future. And I think that's part of why this is really important, because it could give us and the public more reporting requirements that can actually help us, or can help change stuff in the future, which I think is something that we need to talk about, and that's really important. So just want to thank the authors for bringing this forward and for doing everything that we can under our authority to continue to push for transparency in city government, but also ways that we can do structural reform in this police department. So I'll leave it at that, and seeing no one else on cue, I'll ask the clerk to call the roll.
Councilmember Payne,
Aye.
Rainville,
No.
Chowdhury,
Aye.
Palmisano,
Aye.
Vice Chair Wansley,
Aye.
Chair Chavez.
Aye.
We have 5 ayes and 1 nay.
And that motion carries. Our next item is a public hearing on lead paint ordinance. I'll invite staff to present on the current and proposed changes before our public hearing. Welcome.
Good afternoon, everybody. Thank you so much for having me. My name is Alex Vollmer. I manage the Lead and Healthy Homes program in the Minneapolis Health Department, and I'm here to present today on proposed amendments to Minneapolis Code of Ordinances, chapters 240 and 244, related specifically to lead paint poisoning, prevention, policy, and regulations. Lead exposure continues to be one of the most preventable environmental health risks in our community, and even low levels of lead can cause serious health problems, particularly for young children and pregnant women. Low-income renters are disproportionately impacted by this legacy environmental hazard. We know where and why children are exposed to lead paint hazards. And between 2015 and 2024, the Minneapolis Health Department has received more than 1,000 referrals with children of elevated blood lead levels of 5 micrograms per deciliter or higher. Many of our homes in Minneapolis were built well before 1978, when lead-based paint was commonly used. Deferred and neglected maintenance results in ongoing deterioration of lead paint if not repaired or removed, which are the conditions that our team sees when responding to lead poisoning referrals. It continues a legacy of exposing Minneapolis residents, and most importantly, young children, who deserve better. Our current maintenance ordinance does not clearly recognize lead-based paint as a rental inspection standard, nor is it an explicit maintenance requirement. The proposed amendment establishes a clear city policy stance that recognizes lead exposure as a public health hazard and a housing quality issue, and provides a clean framework for how the city views lead paint maintenance. And inspection standards, sorry about that. Just to go over our current ordinances really quick. So Title 12 is housing. Chapter 240 is explicitly called Lead Poisoning Prevention and Control. Currently in 240, the ordinance authorizes the adoption of Minnesota statutes and rules for elevated blood lead response. This is a secondary prevention methodology because it does not give us the authority to go in until after a child is exposed. Chapter 244 of Title 12 of the current city ordinance establishes the city's minimum maintenance standards at residential properties and rental dwelling licenses, but it does not clearly recognize lead-based paint as a maintenance standard. Currently, complaints about lead-based paint go to health for follow-up because of licensing, experience, and equipment. It is currently beyond the scope of the rental housing inspectors to identify lead-based paint, and even though it goes to health, health actually uses the housing maintenance code to issue those corrective orders. So this is a gap in how services are provided and complaints are responded to. We've worked with the city attorney's office to establish whether we can do preventative work with the existing maintenance code. So what we are doing, as evidenced here on the slide, is that the existing ordinance sections for lead paint corrections are 240-100, which allows for renovation and remodeling enforcement, which is the EPA standard for lead-safe work practices and cleaning. 240-110 authorizes lead clearance inspection requirements, which allows for stricter clearance standards to ensure that lead dust and hazards are remediated. And then in the maintenance code, we have 3 sections, 244-500, 244-510, and 244-530 for interior maintenance, exterior foundation, roof walls, and surfaces, and for windows, exterior doors, and hatchways. So we kind of have this patchwork methodology that we're using currently to respond to these complaints. And what ends up happening is that we have a lack of clarity with the current ordinance, and that creates confusion amongst city staff, residents, and property owners about how services are rendered, about how services will be received, and who is responsible for those. So health, regulatory services, and council offices are interested in clarifying the city's ability and authority to have staff conduct testing of conduct testing of painted surfaces for lead, and particularly at rental properties. So I'm going to go into the proposed ordinances right now. So for Chapter 240, we are proposing a policy section and the language that clarifies and establishes a policy that the City of Minneapolis is here to help prevent the poisoning of its residents by requiring that the presence of deteriorated lead-based paint on the interior and exterior of pre-1978 residential structures and on the exterior of pre-1978 non-residential structures be identified and be correctly addressed by reducing and controlling lead-based paint hazards which may be present in order to prevent human exposure to such hazards. We also would like to add language to 240.30, which is enforcement authority, and it states, in accordance with Chapter 244 of Minneapolis Code of Ordinances, the department may conduct an inspection of a dwelling unit, supplemental location, or premises on surface, substance, or objects which the department has reason to believe constitutes a lead-based hazard. The proposed ordinance updates for Chapter 244, again, this is Housing Maintenance Code and Rental Licensing Standards, looks to add a subsection in language to 244-1910, stating the licensee or any agent of the licensee shall allow the Director of Regulatory Services and the Director's designated representative to perform a lead paint inspection as set forth in Section 244.200. And then for Section 244-200, it adds language and subsection to the duties of the licensee, stating this may include a lead paint inspection conducted by the Commissioner of Health or their designee to determine the location and condition of existing lead paint on the property, including interior and exterior building components and potentially soil from the property. What are the goals of the MCO update here? We are looking to establish four things. One is a policy commitment that sets the city in a measure to take proactive measures to identify and control lead hazards in homes. It authorizes prevention and accountability, which encourages property owners to maintain their units in a lead-safe condition, and clarifies that the City Housing and Property Maintenance Code includes lead hazards as a condition of noncompliance, which supports a health in housing approach. It enhances coordination and enforcement between housing, health, and building departments to streamline enforcement and data sharing. It also sets a public health and equity focus by prioritizing the protection of vulnerable residents, including children and families living in older housing. It recognizes that lead exposure is an environmental justice issue, which has historically disproportionately impacted low-income households and renters across the city. That concludes my presentation.
Thanks so much.
So I'd be happy to field any questions that the committee may have.
Thanks, Alex, for the presentation. I don't see anybody on queue, but I'll just say thank you so much for staff and yourself and colleagues for working on this ordinance. I think it is important that we do everything that we can to address lead poisoning that is impacting our community. This issue is a big issue impacting a lot of folks that I represent, especially in the Southside Green Zone. So anything that we can do in the city enterprise to make sure that we can tackle it is something that I will always be supportive of. So just speaking in favor of this ordinance, happy and proud of all the work that staff did on this too. So thanks.
Committee Chair Chavez, we appreciate that.
I don't see anybody else on queue. Vice Chair Wansley?
Thank you, Chair Chavez. I just wanted to get clarification to make sure I'm reading the chart right on slide 3, where it's broken down by housing type, where we're seeing rates of lead poisoning. Mm-hmm. Am I right to read this as it's mostly rental dwellings or rental housing types where you're seeing the greatest amount of lead poisoning rates? Because I'm just, based off of this chart here.
Yeah, Committee Chair Chavez, Councilmember Wansley. Yes, that is correct. These two charts. This is I have two charts showing up here. We have a map from 2015 to 2022, and then just 2024. Mm-hmm. It goes to demonstrate the fact that we are working and responding across the city, but you can clearly see that there are pockets of the city that are more disproportionately impacted. Mm-hmm. Each year we see between 60 and 70% of our elevated blood lead referrals are coming from rental housing. And so that is where we feel like we can have the biggest impact, is by targeting those homes and prioritizing maintenance. We feel like the deferred maintenance and lack of maintenance in those properties are resulting in lead poisoning and lead exposure. So that's where we are looking to enhance and clarify the work that we are doing to try to bring an equitable service to the city and find where kids have been most exposed and where they have the highest risk for exposure, and to just try to prevent that.
Thank you for that clarity. And with the housing type of it being rental units, are you seeing the breakdown between those rental units being like single family homes, or are they multi-apartment dwellings or like duplexes? Are you seeing any themes in that kind of category of rental unit?
Sure. Committee Chair Chavez, Councilmember Wansley, we see that the highest proportion of homes that have lead-poisoned children are scattered site 1 to 4 unit buildings. Yes. So it tends to be smaller buildings, larger buildings, and you could kind of debate about what that means. But 10 units, 20 units tend to be, they are typically kind of newer buildings in like 1950s, 1960s builds. We also find that they tend to be maybe better capitalized as well as maybe better management structure. We just don't see ourselves going out there that often. So these typically are more scattered site 1 to 4 unit buildings. Single families and duplexes are kind of our focus, but triplexes and fourplexes also fall in this category too.
Okay, that good clarity. Thank you so much.
Thank you.
Yep.
All right. Well, thanks so much for that. I'll now proceed to open the public hearing and ask the clerks if anybody signed up.
Mr. Chair, we have no members of the public signed up to speak.
I'll give one last warning. If you wish to speak on this ordinance, please come over here and sign up. With that, and seeing no one else wishing to speak, I will now close the public hearing. I know we jumped a little early, so I apologize for that. I'll ask my colleagues to see if anybody has any other comments or questions. Seeing no further questions or further discussion, I'll move approval of this item. And with all those in favor say aye.
Aye.
Those opposed say nay. Any abstentions? That motion carries. Our next item is a public, thank you. Our next item is a public hearing on the Small and Underutilized Business Enterprise Program Ordinance. I'll now invite staff to present the proposed changes before our public hearing. And if President Payne wishes to make any comments before then, I would also invite that. Welcome.
Thank you, Chairman. I'll be talking a little bit about a brief presentation about the Small and Underutilized Business Program Amendments, Title 16, Chapter 423. We'll cover the ordinance itself. We'll talk a little bit about the disparity study, and then the proposed changes to the ordinance and the amendments to the ordinance, and then what are the impacts of those changes to the ordinance. So the Small and Underutilized Program is in effect, if you all aren't aware, the program is here for the city to remedy past and ongoing effects of discrimination and its ongoing effects or continuing effects. It allows us to set goals for participation on contracts over $175,000. The city does have another program for the target market program for contracts under $175,000 that is monitored and managed by the procurement division. It also has that in order to have a program, you have to have qualified and available women and minority-owned businesses. And if you do have a program, you cannot have any limitations on any business in the marketplace, which we don't. The Small and Underutilized Business Enterprise Ordinance also establishes that the Civil Rights Department administers the program. Contractors, in order to utilize these businesses, we must first of all set reasonable goals for contractors, or contractors make good faith efforts to meet those goals. And this program must be narrowly tailored based on the court's requirements and monitoring enforcement of goals and commitments. So we set reasonable goals on contracts using a system of what's the type of work, what's the availability of MBE and WBE firms, minority women business enterprises, and are there any subcontracting opportunities? Because you just can't set a goal on a contract if there's no available opportunities or businesses to meet those goals and expect a contractor to meet those goals. And it also tells us that we have to monitor these commitments, ensure that a contractor who commits to utilizing a firm commits to that utilization, and we monitor them through. So in order for you to have a MBEWB program or a SUBP program, we had to have a disparity study. There has to be an interest in the government to correct problems in the marketplace. And so the disparity study, which was conducted over the last year or so and concluded this year, was the largest disparity study conducted in the nation, I believe ever. And there were 16 agencies across Minnesota who participated in that. And what it did show was that there was continued disparities in our marketplace. But it also showed that the city had made some improvement. So we were getting about 11% participation over the previous, I'd say 12 years ago to 6 years ago. And then we were up to 13.9% participation, which 2.7% participation is a large jump in small business participation. But we're still so far behind at 20, there's about 20% availability in our marketplace. But in order for us to have a program, we had to have a study. The study shows that there is a justification to have a program that we can continue to make corrections in the marketplace that does not impact other small businesses. And we've done that, and we continue to do that. Again, the goals are based on availability of firms, not some kind of made-up goal. A project's $1 million, so we should be able to get X amount of participation. It's based on availability, and we've continued to do that. And I think that makes our program one of the most successful programs. The program has been very effective for construction and development projects, as well as professional service contracts. But the disparity study did say that there's substantial disparities in MWB participation in goods and services and other procurements. That's one of the program areas I think that's problematic across the United States, because in a goods and service contract and other procurements, there's not a lot of subcontracting opportunities. So those businesses have to be able to bid directly to the city, and you need bonding, you need capital, which is why you have some disparities in the marketplace in the first place, because women and minority businesses just don't have the same access to some of those that other businesses do. But we see that there is some success for goods and services and procurement contracts in the target market program, where there's a lot smaller contracts, but the impact of those contracts compared to the larger contracts is just not the same. I mean, tell that to a small business, though. It's a different story. And then we identify certification and registration participation. So one of the key recommendations of the disparity study was to switch from the federal Minnesota Unified Certification Program to the local CERT program, and this is what we are doing with the changes today. The ordinance amendments really talks about, here's the main things that we're doing with the ordinances: cleaning up some minor program language for clarity, making it easier for people to understand, switching from the federal program requirements to local program requirements. This will really add for greater participation of local businesses. The CERT program has probably quadrupled the number of firms certified than the federal program does. And with all the things that are happening at the federal level, going to a local program is probably best for us anyway. And we were already doing that, so we were moving in that direction. And if there are some other future changes in the law, or if the council wanted to add other certifications, or if we wanted to look at some of the other disparity study recommendations, the changes in the ordinance allows for future changes approved by council or enacted by council for approval. What are the impacts of that? Well, one, the program expires at the end of the year, so we have to continue it. If we do not continue the program, then at the end of this year, it ends and we'd have to start a brand new program. It's prepared for any unforeseeable changes. We've created the language in there, we've modified enough in there to allow the city to really take control of the program and make the changes we need at a local level to be successful. And it allows for local small business participation. A lot of small businesses locally in our 16-county metropolitan area, and it's less burdensome. You know, the burdensomeness of those businesses to participate and to be certified in the CERT program is significantly different than the federal MNUCP program. And we continue to set goals. We continue to allow contractors to participate. We continue to make opportunities available. We can't give businesses contracts, but we can make it available that they are participating in the contracting process and they're not excluded from it. And with that, I will end the presentation.
Thank you. President Payne, would you like to speak before the public hearing?
I would. Thank you, Chair Chavez, and thank you, Director Burns. Just for everyone's background, I've actually been working on this since like 2017 or 2018, and even back then, we were talking about the need to shift from MNUCP to CERT because of how onerous the certification process was. I actually went through the certification process with my business just to understand how rigorous it was, and it took me about 9 months to do. Not because it was 9 months worth of work, but at every step of the process, you would find out, oh, I don't have that documentation in front of me. I got to go get that. And then you'd come back and revisit it. And then you'd get to the next step. Oh, I don't have that documentation in front of me. So it was a really onerous process. And I largely did it just to understand the process. I didn't really think it would be a source of business for me. But getting onto that registry did actually increase the number of random inquiries I'd get about completely unrelated things. I think I got one of those today even still. But I did see that, the email went out that everybody has to recertify. The federal administration is saying if you certified once before, we're going to reevaluate every single one of these, and I wonder why they're doing that, right? So this program has actually been under attack since then. And so I really do view this as much more local control as an outcome, and I think it gives us more of an ability to actually fulfill the goals of this program and have more local control over how we go about doing that. So really just grateful for your leadership on this and partnership on this.
Thank you. Councilmember Posano.
Just briefly, Chair Chavez, thank you, Mr. Burns, for this presentation. These seem like good updates. I really like how the updates end up rooted in data and a response to an outcomes study. I hope that we get a chance to do that more around our organization. So I appreciate that the study shows that we've made progress and support that we'll keep working to reduce these gaps further.
Thank you. With that, I will now open the public hearing and ask the clerk to see if anybody has signed up.
Mr. Chair, we have no members of the public signed up at this time.
I'll make a call. If anybody is here to speak on behalf of the ordinance, please go with our clerks and sign up. Going once, twice, 3 times. With that, seeing no one wishing to speak on this item, I will now close the public hearing and open it up for further discussion with our colleagues and pass it to Vice Chair Wansley.
Thank you, Chair Chavez. Thank you, Director, for the presentation. Also, just want to say thank you to Council President Payne for working with staff to bring this work forward. I actually, while you were presenting and also looking through the 700+ page report that you did of the disparity study, it just really made me proud of seeing a city department take ownership over driving this work forward. I know in 2023, one of the first presentations that we received in the Administration and Enterprise Oversight Committee was from the Race, Equity, and Inclusion and Belonging Department, and they did a presentation on the City of Minneapolis Racial Equity Dividends Index. And one of the areas where it was shown we could do better at reducing barriers for minority communities and also gender minority communities was addressing procurement. They actually gave us a score of 4 out of a 7, and there's a 23-page report that talks a lot about that. And one of the things that they identify as next steps we could do is actually this. They said, go do that disparity study. And it's great, checkbox, and then also put policies in place to also codify those changes. So I just want to say, again, thank you. Oftentimes we see these exhaustive reports be done. We spend lots of money on studying a lot of things, and then they go sit somewhere and gather dust. And this is not an example of that. So thank you all. And if Council President Payne would be down, I would love to be added as a co-author on this too.
I would welcome that.
Awesome. Thank you.
Great. Without objection, you are added as an author. And seeing no further discussion, all those in favor of approving this ordinance say aye.
Aye.
Those opposed say nay. Any abstentions? And then motion carries to the full council. Thanks so much.
Thank you.
All right, colleagues, our next item is a public hearing related to the Minneapolis Civil Rights Commission, approving 10 appointments, 10 nominations to the commission, which will be fairly quick. Thank you for being here.
Absolutely. All right, good afternoon, Chair Chavez and members of the Public Health and Safety Committee. My name is Manir Vaughn, and I'm the Director of the Complaint Investigations Division within our Civil Rights Department. And I am pleased to bring forward 10 nominations for this year's Minneapolis Commission on Civil Rights for Council's consideration. Before I share this year's nominations, I'd first like to share a little bit of information about the Minneapolis Commission on Civil Rights. The Minneapolis Commission on Civil Rights has been around for nearly 50 years. This body, comprised of residents from across the city, is responsible for the implementation and enforcement of the city's civil rights ordinance through public information, education, community outreach, and oversight. The Commission's purpose is as follows: to provide leadership in the area of civil rights, to encourage and educate the public in the promotion of civil rights, to ensure that each commissioner is kept up to date on the latest developments in the law and on community issues, to identify issues of principal concern to members of the community in the area of civil rights, and to set priorities and objectives, to develop a productive rapport with members of City Council as well as the Mayor's office, to advise the mayor, city council, and city agencies and departments with respect to the civil rights matters, to conduct research and studies to best carry out the objectives of the civil rights ordinance, and lastly, to enforce the civil rights ordinance through education, conciliation, mediation, and adjudication. To date, the Commission has made a variety of remarkable efforts to advance civil rights, including working with members of this very body on expanding our civil rights ordinance to add 4 new protected classes. The Commission is able to have up to 21 members, and 6 to 8 of those members must be attorneys. At the end of this year, the Commission will have 10 vacancies. Thus, your approval of the following nominations is critical and will allow all vacant seats on the Commission to be filled. Please note that 1 vacancy is from a resignation and the other is from a previous vacancy. Thus, the 2 nominations for those seats, both seats 5 and 6, will serve the remainder of those terms, which is 1 year, and may be reappointed next year for a full 3-year term. I'll pause there if there are any questions before I go through the 10 nominations.
I think you can proceed.
Okay, thank you. So up first, we have Mark O'Day, who is up for appointment to seat 5. He is from Ward 5. Second, we have Susan Herder, who is up for appointment to seat 6, and she is a resident of Ward 3. Third, we have Carrie Nearing up for appointment to seat 10. She is also an attorney member and a resident of Ward 2. Fourth, we have Sheila Scott, who's actually a returning commissioner that is up for appointment to seat 15, and she's also an attorney member and a resident of Ward 4. Cindy Lord is up for appointment for seat 16, and she is a resident of Ward 11. Kenneth Cooper is up for appointment for seat 17 and is a resident of Ward 12. Reginald Ferguson, who's also a returning commissioner, is up for appointment for seat 18, and he's a resident of Ward 9. John Bowler is up for seat 19, and he's also an attorney member and a resident of Ward 13. Hall Floor is up for an appointment to seat 20, Ward 8. And then lastly, we have Pa Dartau, who is up for appointment for seat 21, and she's a resident of Ward 7. I'd also like to acknowledge that we have a few of our future commissioners in the room with us today. So I thank them for coming, and they're excited to serve the city in this profound way.
Thanks so much for that. I will if there's any commissioners that wish to speak.
No, they're just here.
Great.
Yeah, they're just here to say hi.
Thanks, Manir. I will now proceed to open the public hearing if anybody wishes to speak. Clerk, is there anybody signed up?
Mr. Chair, we have no members of the public signed up to speak.
Thanks, Clerk Michael. No one is here to speak. If you wish to speak, can you please make your way and sign up to speak? Going once, twice, 3 times. All right. With that, giving no one wishing to speak on this item, I will now close the public hearing and open up discussion or questions from my colleagues. All right. Council President Payne.
Thank you, Chair Chavez. Oftentimes we celebrate the leadership of some of our elected leaders. I think both yourself and Vice Chair Wansley were co-authors on expanding our protected classes in our civil rights ordinance, but I just wanted to take this opportunity to thank the Civil Rights Commission because I know that they were leading pretty profoundly in that body of work as well. And I think it's a really strong reflection of what I think good governance looks like. It was, commissioners working collaboratively with city council to pass new civil rights protections, and now we're going to the state to try to advocate for those protections to be statewide. And so I just wanted to thank our Civil Rights Commission for their leadership as well.
Thank you.
Awesome. Council Member Palmisano.
I'll echo that, and I don't want to belabor the point, but would like to thank John Bowler from my ward for applying for this position. He has an incredible background as an attorney working in the public interest and as a district court judge. And just to kind of highlight, here are some of the kinds of resumes of the people that we get to serve in this way. His recent experience working in the Minnesota State House as a research consultant in many different areas, I think makes him really well-rounded and is a great candidate for this kind of work in the city of Minneapolis. We don't have time to highlight all of them, but that's just kind of one example of the really great perspectives that come to this Civil Rights Committee. So thank you for everybody's application. And we look forward to hearing from the Civil Rights Commission from time to time. Thanks.
Absolutely. Thank you.
Great. No one else is on cue, so I'll move approval of this item. And on that motion, all those in favor say aye.
Aye.
Those opposed say nay. Any abstentions? That motion carries. Thanks for being here. We appreciate it. And very excited for the commissioners. Next on our agenda is a contract amendment with Hennepin County for social work services for MPD for the police department. I'll invite staff to give us a quick update on this item. Welcome. Have a key. Welcome.
Good afternoon, Chair Chavez and committee members. My name is Nicole Robbins, and I'm a program manager with Hennepin County Behavioral Health area. I manage the Embedded Social Worker Program and other programs under our Criminal Justice Behavioral Health Initiatives umbrella. And I'm here to give you some updates on our Embedded Social Worker Program. The framework used for our criminal justice behavioral health programs is SAMHSA's sequential intercept model. The Embedded Social Work Program is part of Hennepin County's layered crisis services responses. It supports individuals with mental health and substance use needs. Some of the desired outcomes of our Embedded Social Work Program is to provide a response that is timely, effective, and aligned with residents' needs, and provide services that are easy to understand, quickly match individuals' families and to appropriate resources, offer follow-up support after that initial crisis, use critical resources efficiently, are culturally responsive, improve community health and safety, reduce police involvement, unnecessary transports to the hospital and hospitalizations, and keep residents in the community. And some of the community benefits: a shared financing model between the county and the city, fewer arrests related to underlying behavioral health needs, reduce repeat 911 calls. Our embedded social workers bring a wealth of experience and have a strong support network of social workers that they work with. We have embedded social workers in and or connected to 26 police departments across Hennepin County that support 40 cities. Some program updates. In 2024, over 450 referrals were made to the embedded social work program, and contact was made with over 60%. Some of the reasons for referral were for mental health needs, housing insecurity, medical, and economic needs. Currently, we have 5 embedded social workers assigned to each of the Minneapolis precincts. 2 of those 5 are specialized in working with high-risk youth and receive referrals from all of the precincts. In 2026, our plan is to reduce the number of FTEs and embedded social workers from 5 to 4. This reduction is based on data collected over the past couple of years. We do not anticipate the reduction will impact embedded social work services available to Minneapolis residents. The first precinct was selected due to the lower referral numbers and because there are other resources available to support residents in the first precinct. We have the Behavioral Health Walk-In Center at 1800 Chicago, the Downtown Improvement District Social Workers, COPE, along with other City of Minneapolis programs. The established coverage plan is as follows. First precinct referrals will be split between 4th and 5th precinct embedded social workers, and the 5th precinct embedded social worker will be primary and office at first precinct 2 days a week. Thank you for your support, and I'm happy to answer any questions that you may have.
Thanks so much for the presentation and for being here. I'll first call on Vice Chair Wansley.
Thank you, Chair Chavez. I'm really been wanting to get more updates related to this program in particular, and I think as we're looking at what public health and safety will be in the next term, I would love to be able to have these be baked in quarterly. I say this because I know in my ward we've had several meetings where our 3rd precinct inspector was present and talked very positively about the social worker, the embedded social worker. But I think in this committee and across this body, we're very much leaning, and I think Council Member Palmisano highlighted this, leaning into what does data show. You mentioned also that too in your presentation. Oftentimes I've asked our inspector, what are the data breakdowns of how effective this is being? They've come to community meetings to share a lot of anecdotal stories, especially in reference to the reduction of repeat calls. But I would love to know if there's a breakdown of precinct by precinct, because I know 3rd precinct is in my ward, one of the largest ones, of that 450 referrals. What are we seeing coming forward to the 3rd precinct? And just to have a little bit more information, there's demographic data that's also being collected. What type of calls or type of services are being rendered to those who are getting referred for working with the social worker. So I'm assuming those are being tracked. I don't know if there's a way to get a follow-up memo on that, but those are things that I've asked MPD, specifically our inspector, to say, can you provide that to us? We haven't been able to get it, so I'm really happy to have Hennepin County here to be able to ideally bring forward more data and much more regularly, so we can also be able to confidently share the positive impacts that this partnership is bringing forward for our residents. And so that's just something that I wanted to point out, but did want to ask if there's that type of data available at this current time.
Yes.
Okay.
And thank you, Vice Chair Wansley. We do collect that data and can follow up with the City Council by providing that.
Awesome. So Clerk Michael, I just mentioned breakdown like precinct by precinct, referral breakdowns, and also demographics. data, any that's collected, and the type of services that are being provided, any data, more specific data that pertains to those type of things. Thank you. Thank you.
You're welcome.
Right, that's all.
Thank you. Next up, we have Councilmember Palmisano.
Thank you, Mr. Chair. Your last slide has some information about this, but can you help clarify how these 4 FTEs are assigned within MPD? It says that there's 2. It says there's 2 for high-risk youth. Mm-hmm. Are they housed in certain precincts, and are the other 2 shared, or rather, are the other 2 shared amongst all 5 precincts? Can you help me understand?
Yes, so for
where
the
this is?
2 embedded social workers that focus on youth referrals, they are housed in the 2nd and 3rd precinct, but they take referrals from all 5 precincts for youth. And currently, we have 1 embedded social worker assigned to each precinct, and beginning the first of the year, we will have 1 at 4 precincts. Well, actually, we will have social workers at all 5 precincts. Just the 5th precinct social worker will split her time between 1st precinct and 5th precinct.
Okay, thank you for that clarification.
Thank you. Anybody else have any comments? All right. Seeing no further discussion, I'll make a motion to approve this item. All those in favor say aye.
Aye.
Those opposed say nay. Any abstentions? That motion carries. Thanks so much for being here. Our next item is receiving a report responding to a legislative directive on pollution reduction. I'll now invite staff to give us that update. Thanks so much for being here.
Chair Chavez and committee members, Brett Jelly, Deputy City Operations Officer for Development, Health, and Livability. I'm happy to introduce this legislative directive report and then turn it over to Jenny Lansing and Meg McMahon to present the details. I want to start with some thanks first to the co-authors of the legislative directive, Councilmember Ellison and Councilmember Chowdhury, for participating in this work group and their support and patience, as it has been a bit of a journey and longer than I would have liked, but I'm glad we're here today. And then also really want to thank the staff team who really approached this project in a spirit of cooperation. This was a multi-departmental effort with many different staff. So one of the unique things about the legislative directive is it did direct the formation of a work group to review a number of items that our team will go over today. I think I went into it as a bit of a experiment of how we could respond to a more complex legislative directive like this one. So we had a policy work group that included council members and staff, mayor's office, and then departmental leadership. But then we also had a staff work group because there was a lot of conversations and ultimately report writing that needed to happen. So our policy group met 5 times over the course of the past year, and it was a great way to kind of check in on the progress of this report and ultimately getting to today, where we're happy to report out on the findings, but then also highlighting some work that we're going to start doing as a result of this legislative directive. So with that, thank you for your time, and I'll turn it over to Jenny Lansing.
Thank you, Chair Chavez and committee members. My name is Jenny Lansing. I'm the Senior Environmental Project Manager in the Health Department. So edited for length, this pollution reduction legislative directive asked us, the work group, to research, analyze, and develop environmental justice goals that would reduce air pollution and other off-site impacts that make them inappropriate in an urban environment. Return with analyses and recommendations on the following: air pollution in Minneapolis and impacts on community, existing regulations on air pollution and the role of each level of government, air pollution reduction goals and examples of an environmental justice checklist from other cities, enforcement mechanisms for the use of an EJ checklist, estimated impact of these possible changes, and recommendations on actions that businesses can take. I'll first discuss the air pollution in Minneapolis and its impacts on community. Often when people think about sources of air pollution, they think of point sources, industrial facilities with large smokestacks. Point sources are also known as permitted facilities. Air pollution comes from point sources. It also comes from non-point sources, on-road mobile, and non-road mobile sources. Non-point sources include dry cleaners, automotive shops, gas stations, heating our homes, recreational fires, charcoal grilling, and more. On-road mobile sources are buses, trucks, and cars. Non-road mobile sources include agriculture equipment, the airport, and construction equipment. There are also contributions from biogenic emissions, such as from trees and soil, and fires, agriculture field burning, prescribed fires, and wildfires. In Hennepin County, which is the most granular level of data that we have on these emissions, 3% of air emissions are from point sources. Most air emissions in Hennepin County come almost equally from on-road mobile, non-point, and non-road mobile sources. The figure on the slide shows the breakdown of these emissions in Hennepin County from the year 2020. In the early 2000s, the Minnesota Pollution Control Agency began developing tools that would give a broader picture of the sources of air pollution in Minnesota and the potential cumulative impacts from all sources of air pollution. That tool is known as the Minnesota Air Toxics Risk Screening Tool, or MinRisks. Data from MinRisks are shown on the images on this slide. Many large and small sources contribute to an individual's exposure to air pollution. In Minneapolis, cancer and non-cancer risks from air pollution are driven by mobile sources. The figure on the left shows the cancer risk, and the figure on the right shows the non-cancer risk from all point, non-point, on-road, and non-road sources of pollution combined. Now I'll talk about the existing regulations on air pollution and the role at each level of government, starting with the federal level. To protect public health and welfare nationwide, the Clean Air Act requires EPA to establish national ambient air quality standards for certain common and widespread pollutants based on the latest science. EPA has set air quality standards for 6 common pollutants that are known as the criteria pollutants. These pollutants are carbon monoxide, lead, nitrogen dioxide, ground level ozone, particulate matter, which is also known as particle pollution, and sulfur dioxide. States are required to adopt enforceable plans to achieve and maintain air quality meeting these air quality standards. State plans also must control emissions that drift across state lines and harm air quality in downwind states. Individual states or tribes may have more stringent air pollution laws, but they may not have weaker pollution limits than those set by the EPA. At the state level of regulation, in Minnesota, the Minnesota Pollution Control Agency, or MPCA, regulates facilities as directed by the Clean Air Act and reviews and issues air permits. Any facility that emits air pollutants above certain thresholds is required to have an air emissions permit. Air permits are legally binding documents that include enforceable limits on air emissions, of which the facility must comply. Permits specify how facilities must operate pollution control equipment, the pollution limits they must meet, and how to monitor and report their emissions. There are 81 facilities in Minneapolis that hold an air emissions permit through the MPCA. Through our current zoning code, 33 of these are non-conforming production and processing uses, 23 are conforming production and processing uses, and 25 are not production and processing uses. There are other uses such as large buildings, colleges, museums, and public services. Now I'll talk about the air pollution reduction goals of the City of Minneapolis. Air pollution reduction and off-site impact mitigation goals are articulated in adopted policy documents, including the Minneapolis 2040 Comprehensive Plan and the 2023 Climate Equity Plan. In the Minneapolis 2040 Comprehensive Plan, Policy 66 is air quality. The goal is to improve air quality by reducing emissions of pollutants that harm human health and the environment. In the 2023 Climate Equity Plan, the air goal is to reduce outdoor and indoor air pollution to improve health outcomes, such as reducing asthma rates, with a focus on the green zones and other neighborhoods and households experiencing cumulative air quality impacts. I'm now going to turn it over to Meg McMahon.
Thank you, and welcome, Meg.
Thank you, Chair Chavez, council members. I'm Meg McMahon. I'm the planning director in CPED. So we did take a look at other cities. There's two notably that have fairly robust programs or what I would say is example programs that we looked at. So Newark, New Jersey has, they call it an environmental justice checklist that's implemented through an ordinance that's called the cumulative environmental impacts. And so essentially they require for certain types of projects that need to come through for certain approvals for the city, for those to submit this information. The information generally it's voluntary, but it's used to document and provide data that their health department and they have a health commission will review and make comments on for certain land use application procedures. Boston, Massachusetts has a similar program. They call it a disclosure form. Again, it's related to certain land use activities, and it's designed to collect data. And so we did draft what would be an environmental disclosure form based off of these, and also looking at what data would be useful for our health department as they think about programs that could help incentivize better outcomes for existing businesses. And so from the planning and CPED side of things, we really wanted to tie it to legal findings that we already have attached to our various land use application types. So things that really can help support either the recommendation for approval or denial based on those legal findings. And then for public health's perspective, I can...
So the information that we would obtain in the environmental disclosures, we can use that information to direct businesses to the Green Cost Share program. I'll mention that in further detail in a couple of slides. In addition, the Minnesota Pollution Control Agency has told us that they would likely be able to use the information that we collect through this for use in their cumulative impacts assessments that they will begin using on facilities that hold air emissions permits.
So really our task was to identify what are the touch points that businesses have with the city where we can build this step into processes that already exist. And so we looked at particular land use touch points, such as when a business is entering the city. Frequently, we'll have requests around land use determinations. We have expansions of non-conforming uses. We have conditional use permits, and then we have business licensing. And so we wanted to take a look at each of these possible touch points as ways that could trigger this requirement. In most instances, new businesses that move into a building or begin operations without any particular form of permit or permissions from the city. So it doesn't you don't require a business license to operate in the city. There are some types of business licenses we require, but we do not have a general business license under the city. So unless that business is coming in for a building permit to do modifications to an existing building, an addition, something like that, there is no necessarily we wouldn't know necessarily that they're here. And so in order to implement this disclosure form or checklist, planning staff would need support from the health department also in terms of reviewing this information, collecting it, interpreting it, and helping us make decisions. And so I think we did also look at identifying some internal processes of how that is going to happen, and then what the staff capacity needs are in order to complete that and review things under, our applicable review timelines, because a lot of our land use decisions come under a statutory timeline review. So I'll just take each of these enforcement mechanisms kind of one by one and talk through how that would work. So the zoning code relies on descriptions for each type of land use. So these descriptions include the characteristics of the type of use. It frequently includes a list of examples of the types of uses that are intended to be included within each zoning category, as well as examples of what's not included in that particular category. So in most cases, when a particular use is proposed for a location, it very clearly fits into a particular use category. However, there are some instances where it's necessary for staff to make a determination that requires additional information and some degree of discretion. And so in these cases, the zoning administrator, who is the planning director in CPED, makes that final determination. However, the process typically includes a consensus-based process amongst staff. And so in that instance, we can ask applicants to provide additional information to assist with making that determination. And the zoning administrator's determination can be appealed. So if a business doesn't agree with that decision, they can appeal it, and then it goes to Planning Commission or Board of Adjustment, and then BIS and Council. So an environmental checklist or disclosure could be a helpful tool to assist staff when making land use determinations when it's not immediately obvious whether a proposed production use falls within a low, moderate, or high impact category. And so to help kind of answer those definitions and make that determination. So in this case, CPED staff would ask the business inquirer to complete the disclosure form. We would confer with health department staff and bring them into that discussion before making a determination. And this change could happen really without any ordinance or policy changes because it's really an informal process. The determination itself becomes formal, but the way that we come to that determination is less formal. Non-conforming uses are another touch point that we have with businesses. So non-conforming uses are uses which once were allowed when they were established, but are no longer permitted due to a change in zoning. A structure can be non-conforming if it doesn't meet our built form regulations, such as height or setbacks. Similarly, a use can be non-conforming if it's no longer a permitted use in the zoning district in which it's located. When the land use rezoning study went into effect in July of 2023, most high-impact industrial uses became non-conforming because they're no longer permitted by the zoning code. Non-conforming uses are protected under state law. It allows them to be maintained, repaired, replaced, or improved. However, state law does not protect the right of a non-conforming business to expand. Cities have discretion in how to define the term expansion. So, for example, an expansion can be a physical expansion of a building, but it also could mean an increase in the intensity of the use. So they're, producing more widgets in the same space is also an expansion. Cities may allow the expansion of non-conforming uses, but we are not required to under state law. So in Minneapolis, those who own or operate non-conforming uses may submit to an expansion of non-conforming use application. This is reviewed by a planner. It's presented to the City Planning Commission for a public hearing. There are required findings that must be met in order to approve the expansion of a non-conforming use. And as part of the adoption of the land use rezoning study in 2023, the City Council voted to include an amendment which required additional finding criteria for allowing expansions of non-conforming uses, which is highlighted here. Essentially, what it says is that in order to approve an expansion of a non-conforming high-impact production and processing use, the applicant would need to show an appreciable decrease of adverse off-site impacts. So they can get the expansion, but they have to decrease the impact that business is having on the community around them. And so we feel that that an environmental checklist or disclosure form would be a really excellent tool to determine if the applicant is meeting that criteria. And we have an informal example of that. We had an expansion of a non-conforming production use last year, and we used this tool to gather the information, work with the health department, and really be able to make a good recommendation about whether or not they were meeting that. So again, I think that's something that we could implement really without the change of any ordinances. It would just be a process step that we would have to add. This is a formal process, so it would have to be changed in our ELM software program, and there's some like logistical updates that would have to occur, but structurally it could be done. Conditional use permits is another touch point that we have with production and processing uses, or some types of production and processing uses. So a conditional use is a use which is permitted in a particular zoning district, but that a city may attach certain conditions to its approval. Conditional uses must be found to meet certain findings of fact before they can be granted, and those are laid out by state law. And the city may attach certain reasonable conditions to a conditional use permit in order to mitigate anticipated impacts that could be created by the use. A public hearing before the City Planning Commission is required for all conditional use permits. The CUP process is regulated by state law, and like expansions of nonconforming uses, it has to meet certain findings of fact in order to be met. One of the findings of fact speaks to the conditional use not having a detrimental or detrimental to or endanger the public health, safety, comfort, or general welfare. So that's laid out in state statute. It's a condition and finding that we meet regularly. And again, in concurring with the city attorney's office, we feel that we could use the environmental checklist or disclosure form as a way to validate that finding and make a recommendation for approval or denial. I will note that once CUPs are issued, unlike business licenses, they run with the land in perpetuity. So regardless of who owns the property in the future, so they're very, very difficult to rescind. Cities cannot put an expiration date on them. So there's some limitations to a CUP, but generally, there is a review and touch point period and be an opportunity to gather that information. So business licensing is another area where we have touch points with the city. The city does provide business licensing services for certain specific business types that are authorized under state law for the purposes of protecting public safety. So the city, as I said before, does not have a general business license or require businesses coming into the city to otherwise register or be licensed. So we have a narrow category of business types. Generally, these are alcohol and tobacco-related businesses, animal-related businesses, body art, massage, and tanning businesses, contractors and skilled trades, door-to-door and secondhand sales, dry cleaning and laundry, food and restaurants, and then entertainment and recreation businesses. And so the business licensing process is designed to regulate these specific types of businesses for the purpose of protecting public safety. In each of these cases, the regulations are specific to the business operations inside the building and not related to off-site impacts of any particular business. So a new business license would need to be attached to a specific business type. We can't create a license that's categorical to a land use type, like production and processing uses. It would have to be something very specific, like plywood manufacturers. So in order to utilize this tool, we really would have to stand up a whole new program related to business licensing. Our business licensing staff currently don't have the capacity or skill set to process these types of licenses, and it's also not clear that this type of license is even allowed under state law that's related to off-site pollutants, since the state already issues permits for off-site pollutants. So essentially, I think our finding is that this would be a really heavy lift and require a lot more understanding of state law and how that could work and what that would look like, as well as likely some additional staffing capacity. So we would not recommend pursuing this approach at this time. And then I'll pass it back to Jenny.
All right, thank you. So now I will discuss the impacts of these possible changes that were outlined before you, including staff time and expertise to implement the changes. The Minneapolis Health Department expects to be able to absorb the review of these checklists or disclosures with our existing staff capacity. Through this work, Health may identify more businesses who require registration for pollution control annual registration licenses. However, we do not see this work as an expansion of PCAR, nor are we proposing additional revenue options. With the exception of an expansion to the business licensing program, CPED staff would be able to absorb the collection of the checklists or disclosures with existing staff capacity, with Health Department supporting the review and evaluation of the checklists themselves. However, adding a business license category would be a substantial lift in terms of staff capacity and skill set. Additional staff would be needed to support an expanded business licensing program. On this slide, I will address additional impacts, including the cost to modify policies, programs, procedures, and implementation, revenue options, business impacts and outcomes, and health outcomes surrounding uses or labor. So with the exception of an expanded business licensing program, there would be no cost to implement the EJ checklist or disclosure process into the current workflows. Additionally, with the exception of an expanded business licensing program, there would be no additional revenue collection to implement an EJ checklist process into current workflows. Adding an EJ checklist process into current workflows for land use determinations, conditional use permits, and expansions of non-conforming uses will add a barrier for businesses that will disproportionately impact small businesses that may not have dedicated staff with the knowledge or skill set to complete the checklist. The evaluation of the checklist will also extend the review time and make the process of starting or expanding a business take longer. Projecting impacts on health outcomes surrounding uses or labor would be speculative and therefore has not been included in our report. We just don't have enough information to respond to that at this time. Then on the last piece, we were asked to develop recommendations on actions that businesses can take to meet the environmental goals. The Minneapolis Health Department offers incentives to businesses for pollution reduction projects through our Green Cost Share program. Implementing an EJ checklist could increase opportunities from promoting existing incentives to businesses for pollution reduction. Businesses may apply for the Green Cost Share to receive up to $175,000 for innovative pollution reduction projects. Or businesses with significant greenhouse gas emissions may apply for up to $500,000 through our large-scale greenhouse gas reduction grant. CPED offers a 2% loan program that provides financing in partnership with a private lender for a variety of capital projects a business or commercial property owner may undertake. There are additional opportunities through the Ownership and Opportunity Fund and the Great Streets Gap financing. In addition to these incentives, there are other incentives through jurisdictions such as Hennepin County and the Minnesota Pollution Control Agency, as well as utilities. Partners that the Health Department contracts with on the Green Cost Share program are aware of the various incentives, and they educate the Green Cost Share grantees on ways to stack these incentives for greater pollution reductions. That concludes our presentation, and we can stand for questions. Thank you.
Thanks so much for this presentation. I'll see if any of my colleagues have any questions or comments first. I just want to thank you all for bringing forward this presentation and the amount of work that went into this work group. I look forward to hearing with some of the colleagues that were part of the work group on their experience and work with staff and figure out some next steps. So I just want to thank you all for that. Councilmember Chowdhury had to go to an event, so at least want to acknowledge all that work that staff did. I'll pass it to... All right, we'll be following back up. There's a lot to take in from this presentation and work from staff, so we appreciate that. Colleagues, seeing no further discussion, I'll ask the clerk to receive and file that report. And now on to our last item, I believe. It's a report from the Minneapolis Public Health Community Institute and initiatives related to the CDC Public Infrastructure Grant. And I'll invite staff to get us started. Welcome.
do I find my presentation?
You have it on a flash drive? I don't have it there.
I sent it in.
We don't upload that to
I have my computer.
Figure it
I
out.
sent it in. I thought that it would be on here. It's on there?
No. Where's your computer?
Oh, you want my computer?
Right.
Oh, I had no idea.
You have to take off your laptop?
Well, I thought I sent it in to Chris. I thought that meant that they were gonna have it ready to go. But I guess not. That part wasn't communicated to me. So how do you usually have it set up? So for next time, I know what to do.
On the flash drive.
So you bring in a flash drive for it?
Yeah, I'm sorry.
No one told me that.
I'll stay here to make sure.
I don't know why it's doing this. Why didn't it just open up? There was one on the agenda, but there's nobody else in here. I really want to get it over with.
Right, I meant to swap the two.
Oh, I see.
Yeah.
I have mine so I have to go, it'll be easier.
Thank you. So, this is my first time ever being asked to present, and nobody told me that I had to bring in a flash drive, so I didn't know that.
Okay, that's
Thank
our
you.
clerk duty to do that, so I apologize for
Thanks.
that. Yeah. And then once you get it on here, so then go to the
That's not it. Where am I looking for it?
The
Marquita?
files right there.
Oh, in here?
Yeah.
I'm gonna let you pull it up, because I don't know where you have it.
And then the USB should be at the very bottom here. And then you'll drag that onto the USB.
Where is it?
The USB is here, yeah, but you have to drag it from your computer onto the USB. So I don't know where your
Oh, you're
presentation.
looking for the, okay.
Yeah, so that's the USB file,
Well,
and
good
then
thing you
you'll
sent it to
drag
me.
it in.
I sent it to you, Chris, Damone. But nobody told me that I needed to have it on a flash drive. Yeah.
So drag that onto. Let me try this.
Oh, is there not? That one was.
Oh, I swear I learned more and more with the IT stuff. Is this draggable? I don't know if that's draggable.
You might have to drag it onto your desktop. You could also save it to the USB.
This one's only. Okay, let me do a file.
Download a copy.
Where do you see that?
Go down one more to create a copy and then download right there. Download. Perfect. And that should be on your desktop. Down. Go back to the and if you go to your recently downloaded, scroll all the way, sorry, scroll all the way to the top on the left-hand side there. And we'll see if it pulls up like your most recently downloaded. Scroll a little bit here.
Would it be here? It says stored locally though.
this one. It says unconfirmed.
This is just crazy.
Does this count into our time? Oh, there it is. Okay, so.
They don't have anyone else after us. The person that's on the agenda after us, I guess, isn't going to do it.
Yeah. So you scroll down to there. We're gonna get this PowerPoint one way or another. I'm not letting it not happen. All right, so then drag it here. Beautiful. Yep. Anywhere. Just.
Somebody's got to create like a to-do list for people who haven't done presentations before, so that you know you're getting all the information.
Somebody else doesn't have anything on their laptop.
Yeah, it looked to me like people were, but I guess maybe.
That's it.
Yep.
I'm just gonna scoot down here. Is that-
Great. Thank you.
Thank you so much. Welcome.
Thank you for having us. Chair Chavez, sorry about the technical difficulties. My name is April Graves. I'm a senior public health specialist with the Minneapolis Health Department. What is going on? It's skipping already? Okay, there we go. And I'm going to be presenting with
Giselle. My name is Giselle Martinez-Isea. I am also a public health specialist with the Minneapolis Health Department.
Great. And we're going to be talking about the Public Health Community Institute as well as the Public Health Pathways Program. So just a little bit about the context. The Minneapolis Health Department serves the city of Minneapolis, the largest city in Minnesota, home to almost 500,000 residents, of which 59% are white. One of the focuses of this grant is to ensure that the MHD workforce is, including its leadership, reflects the population we serve. While currently 51% of MHD staff is white, we're looking to, at the leadership positions, and that's only 73%. That is also occupied by a white individual. So the target populations of the FIG grant are the current MHD staff, as well as the Minneapolis residents, with a focus on recruiting and retaining diverse staff, connecting and supporting organizations serving communities of color in Minneapolis, and ensuring that existing staff have the opportunity to progress in their public health careers. So based on many quality of life measures, Minnesota is often cited as one of the best places to live. However, those measures belie significant racial disparities. People of color are twice as likely to live in poverty, less likely to graduate from high school, and less likely to own their own homes, or also face worse health disparities. Health outcomes, including higher rates of mortality and chronic disease. So Minneapolis, being the largest city, has a role in driving those racial disparities, which are in stark evidence when we look at the COVID-19, with age-adjusted COVID infection rates being between 4 times to twice as high for Hispanic, Black, and Native American residents than when compared to white residents. So the CDC's Public Health Infrastructure Grant, or FIG, is a groundbreaking investment supporting critical public health infrastructure needs across the United States. 107 health departments and 3 national public health partners receive funding through this 5-year grant, which started in December 2022 through November of 2027. FIG gives health departments the flexibility to direct funds towards specific organizational and community needs that strengthen public health outcomes. The 3 strategies that this grant uses are workforce, foundational capabilities, and data modernization. Recipients are expected to achieve several key outcomes by the end of the 5-year performance period. Ultimately, this grant will lead to accelerated prevention, preparedness, and response to emerging health threats. Improved outcomes in other public health areas are also anticipated, and all the work done as a part of this grant is grounded in these 3 principles. Data and evidence drive planning and implementation. Partnerships play a critical role in grant program success, and resources are directed to support diversity and health equity. So thankfully, through FIG, we have been able to both expand upon existing work and develop additional strategies to address structural inequities and strengthen the public health infrastructure within our local health department, within our community, and beyond. So during COVID-19, engagement with community organizations serving the most vulnerable communities in Minneapolis was key to successful messaging and service delivery. It was also apparent that some of these organizations doing important work could benefit from capacity building assistance and additional funding to support their efforts. The Public Health Community Institute provides that support. Through the PHCI, newly established or developing community orgs or individuals can receive up to $15,000 to implement a public health demonstration project at the accumulation of their participation and learning through the Institute. The PHCI focuses on identifying and strengthening those community orgs who serve Minneapolis residents at the highest risk of negative health outcomes. Staff from the organization receive training on administrative functions such as grant writing and compliance, financial management, staff and volunteer management, advocacy and community engagement, as well as foundational public health approaches and practices, program development, and evaluation. MHD staff then choose orgs who have completed the trainings, shown commitment toward working to build the organizational capacity, and submitted a compelling proposal for their public health project. They then receive a small grant to support the implementation of a public health focused project or initiative, plus tailored one-on-one coaching to support through our contracted fiscal agent. We plan to fund 10 to 20 organizations to complete a public health demonstration project. We have hosted 12 trainings to date, including our 4 public health core competency trainings. Those topics are listed on the slide. And additional trainings on e-supplier, our city's RFP, vendor and invoicing system, chronic disease prevention and community, communications and marketing, telling your story, working across diverse communities, the realities of Black and American Indian maternal health, beyond the grant sustainable financing, and near science, which stands for neurobiology, epigenetics, adverse childhood experiences, and resilience. We've also created an online library of core competency trainings with corresponding knowledge checks and monthly online lunch and learn opportunities focused on leadership and self-care. So far, we've reached over 100 community members and over 25 community organizations through Public Health Community Institute. We've collaborated with 3 health department divisions and partnered with other city enterprise departments like NCR and procurement, as well as 4 community partners for trainings and 1 community partner who is acting as our fiscal agent and coaching support for Public Health Community Institute participants. So to date, we have received and approved 9 organizations for PHCI demonstration dollars, and I'm just going to highlight 3 today. Open Doors is a healthy household initiative focused on providing services to those diagnosed with mental health disorders to help eradicate the stigmatization associated with mental and chemical disorders and to raise awareness in BIPOC communities. The purpose is really to provide families with support across all dimensions of wellness. Each session begins with a shared family meal, introduces the week's topic in a warm, community-centered environment. And following the meal, parents and children participate in separate age-appropriate groups to explore the topic of grief in ways that meet their unique needs and perspectives. Nourish to Flourish, or PLATE. The goal of this program is to improve participants' nutrition knowledge and habits while also increasing access to practical health tools in low-income settings. They explore the causes, impacts, and prevention strategies for youth health challenges and develop practical skills to promote healthier lifestyles. They also work to support school attendance and academic performance through better health and foster youth leadership in promoting healthier communities. Harden to Paint Hoops. The work is what's working. This program directly addresses critical needs facing Minneapolis youth. Many young people lack consistent access to structured physical activity, balanced nutrition, and positive group environments during out-of-school time. Harden the Paint Hoops promotes healthy movement and exercise through basketball while also reinforcing the importance of nutrition by providing daily meals. The program structure fosters routines and positive habits that are protective factors for youth development, helping to reduce risks of obesity, isolation, and stress. Team sports also cultivate social emotional skills such as teamwork, resilience, and discipline, which have been linked to stronger long-term health outcomes. Data from our surveys indicate that participants in our core competency trainings increased their knowledge in the purpose of public health by 58%, public health's core functions and services by 42%, the social determinants of health by 27%, and health equity by 25%. The Spotlight or additional elective training surveys show that 100% of participants in these trainings say they're likely or very likely to continue learning on the topic as a result of the training. Data from our surveys indicate increases in knowledge across all public health and capacity building topics. In addition to the 4 I referenced on the previous slide, these topics also include program development, design and mapping, increases by 40%. Writing and implementing SMARTY goals and objectives increased by 66%. Conducting program evaluation from start to finish increased by 37%. And skills and confidence in budgeting for public health projects increased by 50%. So in addition to the pre and post surveys, we also conduct surveys on the core competency trainings at the end of each training. And we ask about the effectiveness and relevance of our trainings, as well as to get their feedback on the participation. So here are a couple quotes from participants on what they had to say after participating in the Public Health Community Institute. I'm going to turn it over to Giselle to talk about the Public Health Pathways Program.
All right, thank you, April. So the Public Health Pathways Program is also part of the CDC FIG grant as one of the core competencies to improve the public health workforce. So the Public Health Pathways Program is an internship program that is aimed to diversify the public workforce within and beyond the Minneapolis Health Department, provide direct and early exposure to public health for participants as part of the program, and provide pathways to employment for those who wish to serve the communities of Minneapolis. So PHPP, or Public Health Pathways Program, consists of several major components for various levels of engagement. The high-level focus areas are intended to be as follows. So summer employment opportunities for youth and young adults who are currently in high school, part-time year-long employments for undergraduate, graduate students, as well as non-students who are currently pursuing or interested in a degree in a public health or semi-related field, establishment of entry-level positions with revised requirements to allow for a broader and more diverse pool of applicants, and preferential scoring on open hiring opportunities for those individuals who have participated in and completed the Public Health Pathways Program. So as part of the Public Health Pathways Program, we offer opportunities for activities for the interns or associates to participate in. Some of these activities include MHD division introduction meetings, so they have the opportunity to learn about the different domains and divisions of the health department and how it operates internally and externally. Site visits, so these are essentially field trips so that they can learn how public health is implemented in the vision, mission, goals, and the work of our Minneapolis Health Department community partners. Lunch and learn, so they have the opportunity to present their progress on completed projects to other fellow interns and other employees. We also do public health research article discussions, so they're able to engage in readings and discussions about public health topics of their interest. And then we do career readiness presentations, so they can learn about public health careers and general public health subject matter. And we also do public health career panels, engaging with local Minneapolis high schools and colleges to teach students about the importance of public health and the different career pathways that they can go into. And then, so the Public Health Pathways Program also is a paid internship in itself, so it offers opportunity costs for any necessary trainings or certifications they may need to have, as well as offering meaningful work related to a degree or career of interest. This opportunity is available to high school, undergraduate, and graduate students, as well as non-students that are interested in learning more and gaining public health experience, as well as offering the opportunity to convert to a full-time position within the Minneapolis Health Enterprise or Minneapolis Health Department. So all this data that is included on the next two slides is from our very first cohort that we've had from beginning of this year, from January up until May. So this was a survey taken at the very end of the internship for evaluation purposes. So from all the interns that have responded to the survey, all of them have responded agree or strongly agree to having known more about public health than they had prior to beginning the internship. The majority of interns, so 88.3% who have responded to the survey, also had responded that they had had no previous educational or work experience in relation to public health before beginning the internship. And then half of the interns that did respond and complete the survey said that they would consider going through and considering a public health career following the end of the internship as well. And on this slide, this was taken from a focus group from that same cohort for evaluation purposes of Public Health Pathways Program outcomes and goals. So when the interns were asked about what their greatest takeaways were from the internship, some of their responses included how many more career options there are for me than what I had thought before beginning the internship, how many site visits we took, and learning about how public health professionals use these skills to play their role for their community, them enjoying doing the hands-on work and learning how it impacts the community, as well as being able to gain knowledge of public health and how it impacts the community. And on this slide are just some other more in-depth examples of some of the testimonies from our interns about how they enjoyed doing community work with the city of Minneapolis, as well as being able to be reaffirmed of their passion in what they do and what they would like to do in public health.
So thinking about sustainability, we're very proud of the successes we've been able to have over the last about year and a half. So hit the ground running. Both me and Giselle started on these projects July 2024. But we also know that these successes won't last if we're not thoughtful about sustainability. So our collaborations and alignment across strategies, as well as building relationships with community organizations and national or local partnerships are going to be integral to our ability to continue to sustain and expand upon this public health work, especially right now when funding from the federal level has been cut. So moving forward, we've actually just recently started our 7-month fall cohort about 2 weeks ago. We expanded our recruitment beyond schools and have been collaborated with community. We've accepted applicants with equivalent experience, so we opened it up to more diverse applicants to be able to come and apply. So you don't necessarily have to only be in college or in school. You can apply even if you've been out of school for quite a while. And we're also continuing to work on creating a point system within the HR hiring process so that we can reward applicants that have previously participated. For PHCI, like I mentioned before, we've already approved 9 organizations projects, and they are on the move with that. We have a initial agreement, a midpoint agreement, and a final agreement to get 3 different disbursements out to those organizations and make sure that we're tracking the work and the outcomes that they have put in their proposal. They're continuing to get fiscal coaching and organizational coaching from our fiscal partner. And we're also going to use one of our Public Health Pathways interns to support some of the Public Health Community Institute organizations, so some nice alignment across both programs. Moving forward, it's likely that we'll be able to finish out the 15 to maybe 20 organizations that we had initially planned to fund. We're just moving around some funding to make sure that we have that coaching support, which has turned out to be very, very, very beneficial and helpful to these organizations. In fact, this morning, right before I came here, we hosted sort of a year-end celebration. And one of the comments that stuck out to me from the feedback and the reflection space with those organizations this morning, one of them said, the $15,000 wasn't that much money. I've gotten maybe a little bit bigger grants than that from different participations in the past. But what's different about this experience is that really that one-on-one coaching and support that's really helped to elevate him and spring him forward on his organizational goals and being able to serve the young people. So with that, we want to thank you for your time and offer to answer any questions if you have any.
Thanks so much for the presentation. We really appreciate it. I'll first ask any of my colleagues if they have any comments or questions. I just want to thank you all for staying this long with us and giving us this important update on the important work that you all are doing here for Minneapolis. So I want to thank you for that. I'll ask my colleagues if folks have questions or follow-ups. Maybe we can do it over email, and then we'll just reach out to any of you and if we have any of those questions. Cool.
Thank you.
Thanks so much for the presentation. We appreciate the work you all are doing.
Thanks.
All right, colleagues. I'll ask the clerk to receive and file that report. And seeing no further business before us, I will declare this meeting adjourned. Want to make